You're watching TVC Breakfast. Benue government says it will not relent on its focus to provide medical treatment for children under 5 in remote communities.
It gave assurances of stretching the mission to all local governments in the state, and our correspondent Mayowa Okwato tells us about that.
With over 700,000 deaths recorded annually in the country, Nigeria ranks as one of the highest contributors of under 5 mortality in the world. And according to a 2013 report by the National Demographic Health Survey, Benue State is said to be one of the states in Nigeria with under 5 mortality above national average. Civil society organizations, in collaboration with the Benue State government, have empowered 4 local government areas in Benue State to take ownership of their own health care by improving knowledge of saving children under 5 who face imminent death. The deaths were traced to preventable childhood illnesses such as malaria, pneumonia, diarrhea, and severe acute malnutrition.
Those are the 3 killer illnesses that was identified in most parts of Benue State. So we focus on those 3 because crushing the statistics for these 3 illnesses will reduce the statistics of child mortality in Benue State significantly.
The special advisor to the Benue State government gives assurance that the state government will stretch the mission from the 4 local governments to the remaining 19.
Every life saved is worth the while. We still have a lot of places to be covered. And in doing so, we are willing, and the governor is not willing to, is willing to spare everything to making sure that your activities are facilitated.
Beneficiaries of the outreach also testified that the death rates of the under 5 children had dropped since the commencement of this initiative.
The children, they have been dying before, but when this program comes, no children will be dying.
All the problem we have been hearing about the death of children, since she came to be aiding the children, things got better.
The 4 local governments empowered include Konshisha, Kwande, Obi, and Okboku. Despite successes recorded in Benue State, the health indicators still place Nigeria as one of the highest contributors to under 5 mortality in the world, implying that more work needs to be done. Mayowa Okwato, TVC News, Makodi.
Joining me now from Abuja is the Program Manager, Democracy and Good Governance, Christian Aid UK in Nigeria, Temitope Fashola. It's good to have you join me right now, Temitope. With about 700,000 deaths from child mortality annually, Nigeria stands as one of the countries with the highest mortality rates across the world. Can you talk to us, what is really at the core of these challenges in the country?
Thank you very much, Mike. I think what is at the core of these challenges is mainly around the same issues we have regarding development and how much we're willing to invest in addressing the challenges we have. For instance, what we have done in Benue State addressing the issues of child mortality of under 5, in the last 3 years we've been able to manage over 300,000 cases. And now that the project has ended, the hope is that government is able to scale that up, because development partners can only try to do as much, to show what is possible. However, the onus is on government to scale what we started from 4 local governments to the entire state, such that the impact can be felt not only in the state, but even in Nigeria across board. So it's always about how much we're willing to invest in human resource capacity, and also, for instance, in the available medicines to be able to address the challenges of under 5.
How challenging are the issues of awareness? Over the years, we've been talking about this. These topics have been on the front burner, on the media and all of that. But how much of it are people getting to know about and how to help themselves even before help arrives from the agencies, the partners, and even the government?
The challenges, they are there and they are huge, particularly in remote communities. And you know that there's still the challenge of infrastructure to get into certain communities in Nigeria. and the awareness and people's orientation and cultural orientation still impact largely on how they seek their health-seeking behaviors. And that's why one of the things we will always propose is how government also needs to invest in raising awareness around health-seeking behaviors. For instance, the National Orientation Agency has presence in 774 local governments across the country. How much are we willing to invest in ensuring that we use those platforms to disseminate the right information at the right time to the communities across Nigeria? So using those platforms is very key to ensuring that we raise awareness and address the ignorance across the remote communities in Nigeria.
All right. Some analysts have said that the different partners and even what the government has when it comes to strategy and the different levels of government from the federal to state and even local government are not working on, they are not on the same page, and sometimes it looks like they're working at cross purposes. Funds are coming in and the technical assistants are coming in, but how to coordinate them to achieve one goal seems to be a challenge sometimes.
I agree with you totally, and that's the issue of coordination. And coordination is based also on how you're able to, not just in terms of coordinating interagency coordination, but also coordination regarding data and who is doing what where. And again, the onus is on government to be able to work with, for instance, ministries like planning ministries, the state bureaus of statistics within the planning ministry, to effectively not just generate data, but work with development partners to ensure that the data is in sync and nobody is duplicating the other. And government is able to identify where gaps are and where there is need, such that the needs are filled when investment is coming in from other development partners. So again, it comes to how we coordinate, not just in terms of the agencies of government, but also in terms of data available within each state and also across the country, to ensure that the investment being made is actually meeting the needs available.
All right. What greater steps can we take now to bring down the mortality rates we have in children very drastically?
Yeah, I think Christian Aid in Benue has showed an example that it is possible to reduce that and to manage that. I think the onus now is on government to see to take the plunge and decide to take that to the next level, to ensure that the investment that was made in 4 local government actually can scale up to the other local governments. Because we believe as an organization that change happens addressing the issues of poverty and the poverty of the mind of people or health-seeking behaviors of the people totally is dependent on the kind of investment we can make at the grassroots, at the local level, because change happens at that level. And our government is willing to ensure that that happens, not just in terms of investment for funds, in terms of materials and medicines, but also investment in terms of human capacity and coordination across board will help us attain that level. And I also talked about the issue of data earlier. Data is key to any change we want to make. So government must be able to use, and these structures are there, but how we use them is what's important. Right. And I think if we're able to tap into these opportunities that are available to us and our willingness, when I say willingness, I mean government now,
okay,
as well as the people, to change the paradigm, then things can actually begin to look brighter.
All right, thank you very much, Temitope Fashola, the program manager at Democracy and Good Governance, Christian Aid UK, Nigeria. Thank you for talking to us on TVC Breakfast. Moving ahead now, the first phase of the Federal Housing Authority's Zuba Mass Housing Scheme will be completed this year, with $3 billion already committed to it. Now you're watching TVC Breakfast. Benue State government says it will not relent on its focus to provide medical treatment for children under 5 in remote communities.
It gave assurances of stretching the mission to all local governments in the state. Mayowa Okwato tells us about that.
Over 700,000 deaths recorded annually in the country. Nigeria ranks as one of the highest contributors of under 5 mortality in the world. And according to a 2013 report by the National Demographic Health Survey, Benue State is said to be one of the states in Nigeria with under 5 mortality above national average. Civil society organizations, in collaboration with the Benue State government, have empowered 4 local government areas in Benue State to take ownership of their own health care by improving knowledge of saving children under 5 who face imminent death. The deaths were traced to preventable childhood illnesses such as malaria, pneumonia, diarrhea, and severe acute malnutrition.
Those are the 3 killer illnesses that was identified in most parts of Benue State. So we focus on those 3 because crushing the statistics for these 3 illnesses will reduce the statistics of child mortality in Benue State significantly.
The special advisor to the Benue State government gives assurance that the state government will stretch the mission from the 4 local governments to the remaining 19.
Every life saved is worth the while. We still have a lot of places to be covered. And in doing so, we are willing, and the governor is not willing to, is willing to spare everything to making sure that your activities are facilitated.
Beneficiaries of the outreach also testified that the death rates of the under 5 children had dropped since the commencement of this initiative.
The children, they have been dying before, but when this program comes, no children will be dying.
All the problem we have been hearing about the death of children, since she came to be aiding the children, things got better.
The 4 local governments empowered include Konshisha, Kwande, Obi, and Okboku. Despite successes recorded in Benue State, the health indicators still place Nigeria as one of the highest contributors to under 5 mortality in the world, implying that more work needs to be done. Mayowa Okwato, TVC News, Makodi.
Joining me now from Abuja is the Program Manager, Democracy and Good Governance, Christian Aid UK in Nigeria, Timitokpe Fashola. Thank you so much for joining us. Nigeria is said to have is said to be the 3rd highest infant mortality, infant mortality rate in the world. That was the statistics given in 2017. But what would you say? Why would you say that this is year 2019? How far has Nigeria gone, or how well would you rate the medical assistance or the medical preparedness of Nigeria to give an adequate care to its citizens?
If I heard you correctly, you said, how would I rate the medical
preparedness of Nigeria, or what they've done so far?
Okay, I think there's a lot more that we need to do. For instance, when you talk about medical preparedness, there's a lot happening, for instance, in the Northeast, where, for instance, one of the key issues with child mortality is malnutrition, and there's a lot of issues around that in the Northeast, and a lot of development partners are responding to that. But there's a lot we still need to do to ensure that while we're driving down the statistics elsewhere, we need to also do the same in a location where you have the issues of displacement of people and children not having access to the necessary care that they need. So there's a lot that still need to be done around investing in infrastructure, so health facilities, and there's a lot that still need to be done around medical equipment and medicines. I think we need to look more closely at our supply chain to ensure that not only should we have the medicines available, but the supply stream should not be one that will be challenged as a result of not having the drugs getting to the health facility where they are needed on time. So those are some of the issues that we need to look at closely, and because Nigeria is a very peculiar state, because things that happen at the federal, at tertiary hospitals, more needs to be done at the primary health care, where you have more people that need to access medicines, need to access health care, and so on.
All right, but if you look at some analysts would say that the government is not putting a lot of attention on the health sector, considering the budgetary allocation being given to the health sector yearly.
I completely agree. We're still not making enough investment in the health sector. Our budgetary allocation is still is a far cry to what is expected. But there's a lot we need to do to be able to address loopholes and how we prioritize our issues and what we're investing in. And that's one of the things we as an organization are pushing for in terms of ensuring that the necessary investments are made in the social sector. So you have health, you have things like health, you have things like education, you have infrastructure, you have agriculture. Those kind of things are the things that would drive the indices down when you begin to talk about the issues of poverty. And for us, we believe that to be able to address such issues as an organization, you need to address the systems that keep people poor. And those are the kind of systems: primary health care, basic health education, those basic things that every Nigerian needs and should have access to as a right, are things that we need to invest more in and ensure that it gets to the ordinary citizen at the local level. And for us as Christian Aid, we think that's very critical, so just like every other development partner, and we think there's a lot more that needs to be done, even if development partners are going to be supporting government to do as much. But the resources development partners are bringing cannot be compared to what government can invest, because government is the highest investor that you can have in Nigeria. And that's why we think a lot more needs to be done in terms of making investment in Nigeria to affect these social sectors.
Well, let's look at the issue of the TBAs, the traditional birth attendants, and what their contributions should be. What their contributions should be. What would you say? How should we be able to merge traditional medicine with the orthodox medicine? What should be the way forward, considering the TBAs?
So, if I heard it correctly, sorry, I didn't hear you very well, but I think we need to address the issues of making healthcare accessible and available. Accessible, available, and affordable. And there are basic healthcare that needs to be accessible, affordable, and accessible at the primary healthcare level. Those are the priorities to be able to drive down the indices we currently have to ensure that every life is worth living. And for us in Christian Aid, we believe that for every life, it needs to be lived if given the opportunity, based on the kind of systems available within that country to ensure that we have access to the basic amenities of life. So that's one key thing in terms of accessibility, affordability, and availability of necessary healthcare services.
Program Manager, Democracy and Good Governance, Christian Aid UK in Nigeria, Temitope Fashola. Thank you so much